of the topic of euthanasia deals with the moral question of at which point can any person deny medical help for their illness. Medical treatment is put into two categories: ordinary treatment and extraordinary treatment. Ordinary treatment is any treatment a person takes for an illness that does not cause excessive pain or excessive burden on the patient or the family of the patient in question. Extraordinary treatment is any treatment that does cause any excessive pain or burden. Another key part of extraordinary treatment is if the burdens outweigh the possible benefits. If the burdens of the medical treatment do not exceed the possible benefits, then the treatment is no longer extraordinary, but instead it is just ordinary treatment. In other words, a treatment could be very painful, but if the benefit outweighs the pain, then it is not extraordinary. The Church teaches that everyone has the right and duty to preserve human life if the life can be preserved by using ordinary means of care. So, if a person is getting ordinary means of care, then the Church says that they undergo said medical help to get better. To clarify, the Church always wants the preservation of life, no matter what. But if the patient is not morally obligated to do so, if the treatment to preserve said life is an extraordinary mean of treatment. For example, if a man gets a disease that is potentially fatal, that can be easily treated with no pain and very little burden, he is morally obliged to take this treatment. But if the medicine caused severe pain and other side effects, the man could choose to not take this medicine. Ordinary and extraordinary means of care do not fall under just black and white. The gray area is huge. For example, the ordinary treatment for one person could be extraordinary for a different person. In the end, to answer the question of if a certain treatment is ordinary or extraordinary, the doctors must look specifically at the patient in question and not just at the treatment they are giving. The principle of self-determination states that since we are all made in the likeness of God, we can then all make our own individual decisions. But the Church builds on that point by saying that whenever a decision is to be made, it should not be done in isolation. The Church tells us to consult doctors, our family members, and even members of the clergy when making a medical-based decision. In the end, though, the Church makes the decision of taking treatment pretty easy for us. If the way to preserve a life is under the ordinary means of care category, we must pursue that treatment no matter what. Only when the mean of treatment is causing excess pain and the burden outweighs the benefits does the patient have a real choice on whether they want to pursue the medical treatment or not. The reason a person cannot deny ordinary means of treatment is because that means the patient is denying treatment only to bring about death. Purposefully bringing about death is suicide, and the Church is 100% against suicide at any time. And that is why denying ordinary treatment is not allowed in the Church. In conclusion, the Church teaches that if a patient can regain health by taking treatment that is not excessively harmful, then they must pursue that medication. Once the medication becomes excessively harmful, the patient, along with doctors, family, and clergy, can decide whether or not to take the treatment.